Greetings, folks. My name is Davina Towns, and I'm a senior technology professional. Welcome to my lightning talk. Today, artificial intelligence is commonly used to summarize long documents, conduct research, and find TV shows to entertain us. It's also used to track our fitness goals and complete mundane tasks, just to name a few examples, following a pattern that I recognize as performing for us. It can be used for company organizational goals or smaller targets like individual goals. In terms of health, it can be used to track our sleep or monitor heart rate to interpret results or even generate a 6 week fitness program tailored to a person's age, weight, or access to equipment and their end goals. But how about identifying communities where health and safety risks are high? How about using artificial intelligence to recognize where people may be suffering in America? How about supporting initiatives to improve population health? How about using artificial intelligence to tackle health disparities in America? Together, we will explore how artificial intelligence can support populations from a humanitarian perspective, not for financial benefit, not for making a choice about entertainment, but for recognizing communities that may be suffering and supporting initiatives to improve population health in America. First, what do I mean when I say health disparities? The American Journal of Public Health describes these as differences in health that are associated with social and economic advantage, where marginalized and disenfranchised groups of people are adversely affected. How can AI help tackle these disparities? There are numerous ways, and I will present you with four opportunities to identify top health risks and trends impacting the population, analyze historical data of at risk communities hit hardest by recent disasters, investigate model solutions of communities with low risk factors and compare them to those experiencing disparities, locate critical deserts, areas with inadequate access to healthy grocery stores and fast food options, public transit, healthcare facilities, or other community resources. Healthy People 2030 is a national public health initiative managed by the Office of Disease Prevention and Health Promotion. Its purpose is to address critical health priorities impacting the nation by setting measurable objectives to target over a decade, providing data, evidence based resources, and tools to organizations. Healthy People 2030 assists communities in determining their vulnerable populations and setting individual priorities to improve their overall health and well being. So, how can we break the pattern of disparities with artificial intelligence? By combining the power of AI with a problem solving method focused on supporting vulnerable areas. Let's start with define to identify at risk communities and vulnerable areas with significant risk factors to define the problems. Next, we analyze, determine the root cause of these identified issues. With this information, we can move to brainstorm, gather potential solutions, asking what resources would best support the community, as well as identify what resources are missing in this community that are present in areas with low disparity. Upon deciding on the optimal solutions, we move to deploy our solutions in the implement phase, working with communities in order to reduce those disparities. And lastly, we move to the monitor phase and validate the solutions. We monitor and evaluate the progress made and establish the successes as the standards to be upheld, all the while accepting feedback and making adjustments as needed to ensure that solutions stay aligned with the community's needs. So, how would we apply this solution? Where would this work? I ask you all to recall the tragedy of the 2022 mass shooting at the Top supermarket in Buffalo, New York. At that time, it was the only grocery store in the East Side neighborhood, and following this terrible event, the store was closed for 2 months, limiting the reeling community's access to healthy groceries. Support was provided to the community in the aftermath of the tragedy, with individuals bringing in resources and providing shuttles to the nearest supermarkets. There are many lessons to be learned behind this occurrence. How many critical deserts exist in America? How many other communities could be at risk of losing access to their main source of healthy groceries, or their main form of affordable public transit, or the lone health clinic that serves an overwhelming part of the population? With the Healthy People 2030 objective, five-step problem-solving method, and the capability of artificial intelligence, what challenges can we tackle? What can be achieved by using AI to support humanity? What can we achieve by supporting initiatives to improve population health? What can we achieve by tackling health disparities in America? What can we achieve by breaking the pattern with AI? Thank you.